so you can get all information you need as far as this procedure is concerned. For those who are already aware, I guess you will still get something important that maybe you missed out when doing your research on that topic. And first of all, I want to know from my co-presenter, Lucy Liango, who is currently with me here. Lucy,
yeah,
how are you?
I'm fine, thank you.
A very sensitive topic today?
Yeah, very, very sensitive.
Lucy, I'm good, but our topic can make my heart to,
You feel like shivering a bit.
Exactly. Lucy, have you ever wondered if you want to do a BBL?
Well, it has never come to my mind because what I know is I'm naturally beautiful.
Oh, I like that.
Yeah.
So, to edify us on this particular procedure, we have an expert, Dr. Ahmed NFOR, public health expert. Good afternoon, doctor. It is a pleasure to have you on the program today.
Good afternoon, Immaculate. Good afternoon, Elsie. It's nice being with you people this afternoon.
The pleasure is shared.
The pleasure is shared, of course. So tell us more. What is BBL all about?
Okay, BBL, as you rightly first said, Brazilian boot lift is a kind of surgery which is done to transfer fats from some other parts of the body and then implant in the buttocks to make the buttocks increase in volume and in shape.
In volume and in shape, okay.
Yes.
Now, is everyone eligible to carry out such a procedure?
Actually, those who go in for this are people who are, first of all, reach a right development age, that's from 18 years onward, to be sure that the tissues, new tissues will not develop back much. And then also you have people who maybe are not satisfied with the buttocks they have, the shape of their boots, and they want to increase it, and they are matured, they can go in for this. People have a good skin tissue, because it's not all skin tissue that can hold the fats that is transplant. So the doctor have to evaluate to make sure that the people have the tissues that can be able to carry out the implants.
Okay, so doctor, want to know what happens before the procedure of the butt lift?
Yeah, before the Brazilian butt lift, the doctors have to carry out a series of laboratory tests. As I first said, the tissues of the buttocks have to be analyzed, the tissues of the skin, and then the tissues of the areas where there are excess fat, like the hips, like the thighs, like the tummy. They have to be examined whether if the tissues can be resistant and they are elastic, so that if they remove the fat, there should not be any negative impact on the areas.
And what happens after the Brazilian butt procedure? How long recovery period?
After the Brazilian butt operation, the doctor gives an advice to those who have carried it. The person who has carried the thing may take about 4 to 6 weeks for recovery. It could go for months, and some people, depending on tissue growth and tissue resistance. And then the people who have carried out this operation are advised not to sit on one spot for long. That's sedentary. They don't have to do this because it will have an impact on the tissue or the areas that have been also operated. And then they have to quit cigarette smoking. Things that have nicotine, they have to allow those things. They can have a negative impact on the areas that have been operated. And then lastly too, we most after operation, people have bleeding. There are a lot of bleeding experience and pains with scarring after this operation. That's why most people are asked to remain in the recovery ward, and there is a follow-up done to be sure that everything goes successfully. It could take months for other people and take few weeks for others.
Okay, Ima, before we continue, we would like to give the contacts that anyone who wants to join on today's edition. We have 67054 7049, 67054 7049, and 656 622222, and repeat 656 622222 at the end for those who like to join us on today's program.
So, doctor, now you made mention of some important tests that needs to be carried out by the surgeon before such a procedure is carried out.
Sure.
We want to know, is there a possibility for maybe if I don't have enough fat tissues, as you earlier mentioned, is that possible for someone to take it from some other person's body and put it on mine wherever I want to have that changes on my body?
Actually, absolutely, it may not be possible because that's what we call skin compatibility. Your own tissues can well fit into your own body. Bringing fat from other places, it may go, but it may have some long-term effects. And then secondly, I think it will be difficult for somebody to donate fats for another person for such a kind of operation. So we don't advise, we don't even advise those doing it, talk less of those who have to give fats for that.
Are there any advantages of carrying out such a procedure?
Well, there are psychological advantages. Yes, people who have done it, they wanted their shape to, their buttocks to have a shape. They have that confidence. They move now with some psychological confidence. And then one of the advantages too is that it's one of the easiest as compared to other methods of boat lift. This is one of the safest method to carry out. And the advantage too, as you just asked a question, whether the fats can be taken from another person, the advantage now is that we are not bringing fats from anywhere. They take parts of your body to put it back, to graft it or implant it back into your body. So this is an advantage, not bringing something from somewhere. So this is, it can go long as compared to others. It can go for more than 10 years before some adjustments are done.
Now, doctor, we are talking about the advantages. What makes BBL deadly?
The BBL is deadly because it has a lot of side effects. There are a lot of side effects. We have what we call fat embolism. Fat embolism is when you carry fats from another part to implant in another part.
We have a call on the line. We'll be coming back to that. Hello?
Bonjour.
Bonjour, madame.
Bonjour, moi c'est Ariane depuis Edea.
Ok. Votre question, madame.
Oui, je voudrais demander au médecin si après cette chirurgie, il n'y a pas de conséquences.
D'accord, on va vous répondre dans quelques secondes.
Oui, et je voudrais aussi savoir si une femme fait la chirurgie genre pour diminuer le ventre, est-ce qu'elle peut encore accoucher normalement?
Ok. On va vous répondre dans quelques secondes. Doctor, I guess you got the question from that girl?
Yes, I think she's asking whether there are side effects.
Exactly what you were talking about. It's, the question Lucy asked.
Yes.
What makes it deadly?
Yeah.
And also, if a woman has given birth, or if a woman plans to give birth, can she carry out such a procedure, right?
Yeah, the BBL procedure.
Yes.
No, completely discouraged. Completely discouraged. Carrying a baby at the gestation period, a woman needs to be very careful as far as anything concerning medication operation is concerned. So it's completely out of question.
So does it mean if you have not yet given birth, BBL should be out of your mind?
I'm saying if it is a woman at the gestation or during...
No, she means like if you have not yet given birth...
No, it has nothing to do with reproduction.
Okay.
It has no impact with reproduction. We are talking here about transplanting fats from areas where there are excess fat to put in another part. It doesn't concern the gynecological system.
Okay.
So it has no problem.
Now you were talking about what
the
makes
risk factors.
BBL deadly.
The consequences,
Yes.
like she's asking, she wants to know.
Yes. So the consequences, the infection, there is possibility of blood vessel damage and nerve damage. Before I come to the big one, there's a possibility of blood vessel damage. At any time there's a transplant, there's a cutting and implanting, there's always damaged. And then another one, it can lead to subsidiary infections. The infections could come up because the tissues of the body has been exposed. There are possibility for infections. Then you have a bruising, a kind of pain which you feel as if you are being massaged with some hot substances. This goes for long. Then we have another fat embolism that I was talking. This is the main problem that kills many people. In fat embolism, tissues, the fat that has been implanted, they finally don't follow. They go into wrong direction. They enter the blood vessels, and they could cause blood vessel blockage, or they enter like the lungs, the liver, the kidney, and the heart. And this can lead to failure of one of these organs or completely big complications that may not be able to handle.
Now, doctor, when we go through the procedure or during the operation or during the surgery, can it lead to death?
Yes, as I was saying about fat embolism, that's one of the primordial things that has caused so many deaths during Brazilian boat lift operation, plastic surgery. Because when the fats change direction and go to vital organs like the liver, the kidney, the heart, and the lungs, in particular, the lungs have been one of the most common organ that has been attacked by fats that has are coming from this kind of operation. It can lead to death, instant death. So you see, so many deaths have been recorded at the theater level, where people are carrying out this operation and it leads to death. So it's kind of suicide mission. It's kind of suicide mission because we can never know the output. We can never know what will happen. We are talking here about fat transplant. The fat is uplifted, washed, and then processed, and then implant.
We have another call on the line. We're coming back to you. Hello?
Hello?
Yes, madam.
Yes, please, I have a question.
Go ahead. Your name, where you're calling from, and your question.
Okay, my name is Laura Nashus. I'm from Yaoundé.
Okay, go ahead.
Yes. So I want to know, is it possible to remove fat from your stomach, let's say from your belly, but it doesn't go elsewhere, like just to remove the fat on your stomach? You don't want it to give the BBL shape or whatever at the bottom.
Okay, got it. You got a question?
Yeah, I got a question. I think the caller is asking whether there's possibility of removing stomach fat without actually using it somewhere else, just to scrape it out. Yeah, it's possible, but it's not done at the level of our country. If somebody is doing it, it should be clandestine, because it needs a very high level operation. It's done in the US, it's done in Europe, where people who have very large tummy, they visit specialist doctors. Centers have been created for that. And these fats can be scraped. And then some surgical, that's we call it plastic surgery, and then remove completely, and then you have to stay in the recovery room for some time. Your fat is given to you, you go and bury it, you throw it somewhere else. This is possible out of our context in Cameroon.
Okay. Now, can BBL be reversed?
That's one of the biggest challenge with BBL, because it is difficult to reverse BBL. Why? The reason being that we age up. As we age up, our tissues grow, we have tissues growth, we have tissue damage. So by the time you want to remove fat again, where you place somewhere, it will no more be the shape.
We're coming back to that. We have another call on the line. Hello?
Hello?
Yes, sir. Good afternoon. Your name, where you're calling from, and your question.
Good afternoon.
Can you turn off your receiver, please?
I am Mr. Muge Martin calling from Betwa.
Can you please turn off your TV or radio set?
Hello?
Yes, head on with your question.
Yeah, I just want to find out whether such people carrying out operations as such, is it because they have too much money, or is because they want to tell God that, God, you did something wrong that I don't want? That is just all.
Okay. Okay. Doctor, I guess you just answer him directly.
Yes, I will just answer, because it was one of the things we were going to talk about, that whether this operation is what its value.
Yeah.
Yes, I think this is, in the African context, this is out of question. Beauty does not lie only in the buttocks or the breast. Adding extra buttocks, adding extra breast, adding anything extra in your body, it seems as if you are just telling God that what you did was not up to my standard. You made a mistake in making me. So we are discouraging the youth of today. Beauty is in the heart. Beauty is something linked with culture. And then love is something that comes right from the soul and the heart, not the shape. There are people with very good shape, but they don't have lovers.
That's true. Now, before he was calling, we were talking about the BBL.
If it can be reversed.
If it's reversible.
Yes, okay. I was just discouraging that one of the challenges with BBL is that it's difficult to reverse, because after 10 years, the tissues of the buttocks are not more the same like they were before. So you have to remove these fats. It is possible to remove the fats implanted, but the buttocks now would have contours. You see a buttock with some hips.
Shape.
Yes, improper shape.
We have another call on the line. Hello? Hello? We just lost that caller. Okay. Yes?
Yes. So we are saying that practically we can say almost impossible to reverse it, because the consequences of reversing is by far more than the act that was done before. So we are advising that people who go for BBL should know that it could be a bit permanent.
So, is there a difference between the Brazilian bird sleeve and the implants?
Yes, there is absolutely. The Brazilian breast lift involved fat transplanting, and what we use what we call liposuction to extract fat from the body. But why boot implant is where we bring synthetic materials.
We have another call on the line. We'll come back to you. Hello?
Hello, madam. Good afternoon.
Good afternoon, madam. Your name, where you're calling from, or your question?
Yeah, my name is Donna. I'm calling from down there.
Okay.
I just want to ask if how can I do to remove stomach fat in my stomach fat after childbirth?
After childbirth. Okay. Doctor, those questions.
Yes.
Yes.
I think she's suffering. She have crisis with too much fat. It's normal. After childbirth or after cesarean section, operation in most women during birth, there's always accumulation of fat in the adipose tissues of the stomach. She should go to a specialist doctor. She should go to a doctor. A doctor may put him on some anti-fat therapies.
But then will you prescribe BBL for her? I think there are other ways of burning fats, maybe going for speed.
Yes, that's exactly what I'm saying, that if she can go, either she goes to a doctor or I think some people, if she looks around, over-the-counter medication, natural therapies. Some people have some natural therapies which are really recommended for stomach fat elimination.
Even sports.
And then doing a lot of exercise too. But now when it is childbirth and childbirth and operation, the fat may be a bit resistant. So she will need something of natural therapy to gradually flush out the fat with time. She needs to be patient. It will go gradually. It's not a fast process anyway.
Okay, we were talking about the difference between the Brazilian birth sleeve and implants.
Okay, yes. So I already explained the BBL. The implant is bringing in synthetic materials like silicone and implanting into the buttocks. It is done the same for the breast, where silicone materials are put to make it's not really lifting the breast, but making the breast develop a larger volume. Wow. Yes, it's still a kind of surgery. But in this case now, the difference is that this one is reversible. It can easily be removed. But it has more complications again, more than the BBL. But the silicone can be removed easily.
Tell us about those complications.
One of the complications is that those synthetic materials could lead to other cell deterioration in the body, which can result to cancer. It has resulted to cancer in so many cases. So that's one of the main things that we should be shy. Any other thing aside, but just the fact that putting synthetic silicone material in the body for quite a long time, some of these can provoke abnormal cell development, which can be cancerous.
What last word do you have for those who plan carrying out this procedure, maybe in the one time, in 2 weeks' time? BBL
one day even.
Maybe one day time. So people have been thinking about it,
yes, I think one of the greatest challenge at the context of Cameroon, we know people don't do this. We go mostly for drugs, synthetic drugs, for breast lifting and buttocks lifting. Some work, some don't work. But the youth going into this, they don't know the long-term effects. We're advising them, the company will never tell you the long-term effects of some of these things you are consuming. You only end up in a confusion in the future. Please. Love is not cheap. Please appreciate what God has given to you. Women with dry buttocks are still as beautiful as women with big buttocks. Manage what God has given to you. Manage the beauty God has given to you. Don't do extra. Those extra people, pharmaceutical industries which are producing this will never give you the disadvantages.
Okay.
So I advise that we should stay like Africans and maintain our culture and appreciate what God has given to us.
Lucy, any last word for them?
Well, like what the doctor said, it's just for us to love what we have.
You are beautiful just the way you are, so remain authentic. That's it for today's edition of the program Yearn Your Health on Equinoxe Radio Multimedia. We had as guest Dr. Ahmed NFOR, public health expert. Have a wonderful day in the company of more interesting programs on Equinoxe Radio and, of course, television.
Vous écoutez Radio Equinoxe, la chaîne du peuple.